Good morning, everyone. My name is Mina Schultz. I'm 32 years old, and affordable health care saved my life. 7 years ago, I had just finished graduate school, and I was planning to go off of insurance for a while. But because of the ACA, my parents were able to put me on their plan. I didn't think much of it because I was healthy, and they insisted, and the law made it possible, so I said okay. 2 weeks later, I got news that changed my life. I was diagnosed with bone cancer. I started treatment immediately. I had 27 doses of chemotherapy, 5 surgeries, and other care that totaled hundreds of thousands of dollars. That year was terrifying. There's actually a moment about halfway through my treatment where I came into my hospital room and found my mom there. And I thought, oh, it's a surprise visit. It's almost my birthday, so she's coming to visit me. But it was because the doctors thought I wasn't going to make it. She had come to say goodbye. As hard as that year was, it would have been even harder on me and my parents if I weren't insured. They could have gone bankrupt, and my future could have been ruined. But the good news is that I was insured, and I did get better. Now the ACA still helps me. I'd be uninsurable if it weren't for the rule outlawing discrimination against people with pre-existing conditions. I hate to think of where I'd be without insurance. My whole life would have been derailed, or worse. That's why after I got better, I devoted myself to making sure people got coverage. I got certified as a health insurance navigator, and now I work for Get Covered NYC, connecting New Yorkers to free and affordable health plans. I'm proud of the work we're doing, but I know there are still hundreds of thousands of New Yorkers who aren't covered. People who are foregoing treatment are fighting for their lives while they fight hospital bills that they can't afford. I know how dark and hopeless that can feel, and no one should have to struggle that way. So that's why I'm so glad to be here next to Mayor de Blasio. He believes that healthcare is a human right, and he's going to do what it takes to get care for all New Yorkers. Thank you.
Thank you. Thank you. Thank you. Mina, thank you. First of all, it takes courage to tell your own story, and I can only imagine how difficult that time was. But I want to just tell you, I really admire you for taking everything you went through, all that challenge, all that pain, and deciding you were going to turn it around and help other people. And every single person who you got onto health insurance through Get Covered NYC, your own efforts, you're making sure that people have the care they need when they need it. I really admire you for what you've done. Let's thank Mina, everybody.
Thank you.
This is why we need to guarantee health care for all New Yorkers. It's as simple as that. Because no one should have to live in fear. No one should go without the health care they need. Health care is a human right. In this city, we're going to make that a reality. In this city, we're taking that ideal and putting it into practice. From this moment on in New York City, everyone is guaranteed the right to health care. Everyone. We are saying the word guarantee because we can make it happen. Because of the great professionals you see behind me here at Lincoln Center and at facilities Lincoln Hospital. Lincoln Center is good too. Here at Lincoln Hospital. All of these professionals and other great New Yorkers like them are going to be in the front line of this new effort. And I want to say I've been at Lincoln Hospital a bunch of times. It's a home away from home. I really admire what all of you are doing. Everyone, give your neighbor a round of applause. Thank you for all that you do. For too many New Yorkers, they live in fear. They live in fear of getting sick. They don't know where to turn. They don't know how they're going to afford health care. About 600,000 New Yorkers do not have any health care coverage at all. That's as many people as live in the entire city of Milwaukee or the entire city of Baltimore. 600,000 people with nowhere to turn except the emergency room, which is exactly the last place we want to see people go. Today, we take a huge step forward because we're telling people it's guaranteed. That's going to change people's lives, and it's going to change the way they act. Because when you know something is guaranteed, you act differently, you behave differently. You now know it's there for you. It's meant to be there for you. It's not something you have to fight for or struggle for. It's not some maze you have to complete. It's guaranteed. It will be accessible. It will be available. The idea is no one should have to wonder. And I can say, you'll hear from Shirlane in a moment, but when we were young parents in particular, we spent a lot of time trying to figure out where to get our kids what they needed. When we were older parents, we spent a lot of time trying to figure out how to get services for our children that we didn't know how to navigate. And there's lots and lots of New Yorkers who are in a much, much tougher situation than we were in. What we know is if people don't know they have a right to something, they're going to think it's not for them. They're going to think there's nowhere to turn. You know what? You know how many people in this city every single day know they're sick and they don't have a doctor they can turn to and they don't have enough money in their pocket, so they just go off to work sick and they get sicker? And it ends so often in an emergency room, a situation that could have been prevented so easily if people just knew there was a place to turn. When this plan is fully implemented, every New Yorker who needs a doctor will have an actual doctor with a name and a place. They're going to have a card that will empower them to go to that doctor whenever they need. A primary care doctor, an actual person that you can turn to, that's your doctor. And the specialty services that will make all the difference, whether it's maternity or GYN, let me do it again, GYN care, whether it is mental health care, and you'll hear from the First Lady in a moment, which has been so hard for people to access for so many years, pediatric care, you name it. The things that people need will be available to them. And this is going to be a difference maker in their lives. The message will be, go get the health care you need when you need it. Don't wait. Don't feel it's not for you. Don't feel you can't afford it. Get the health care you need when you need it. You won't end up in the emergency room. You won't end up in a hospital bed if you actually get the care you need when a disease starts, not when it's already too late. So that's what we're here to achieve. This is built on a series of actions that were taken in the last few years. Obviously, what's been done to strengthen health and hospitals. Again, I want to thank everyone behind me for their extraordinary work. Obviously, you're going to hear from Dr. Mitch Katz in a moment. Want to commend his predecessor, Stan Brezhnev, as well. And you're going to hear from Dr. Mina de Blasio. Want to commend her. All the people who work so hard with the folks in each of our facilities to turn health and hospitals around. This plan today wouldn't be possible if that hard work was not done over the last few years. To bring health and hospitals back from the brink and allow it to now get to the work of providing high-quality care all over this city. Obviously, you're going to hear from the First Lady about Thrive and another crucial initiative, Healing NYC, that contributed to building the kind of framework where we could get care to people when they need it. And because of Get Covered NYC, 130,000 people got health insurance through the exchange who wouldn't have if there wasn't such an expensive outreach effort and effective outreach effort. I want to commend all your colleagues also, Mina, for their amazing efforts. All these pieces have helped us to get to the launching pad that we can now go this last step, this last mile, to get health care to everyone. So, look, you might say right at the jump, is this something that ideally should be handled in Washington, D.C. or in Albany? Yes, it should. Let me just make that clear at the outset. The solution, the ultimate solution, is single-payer health insurance for this whole country, or Medicare for all. That's the ideal. That's what we need. And I strongly support the single-payer bill that's going to be considered in Albany this spring. Because if Washington won't act, then our state government should act. But you know what? We don't wait here in New York City. We don't wait. We're not going to fall for the trick of hanging around waiting for Washington, D.C. to solve our problems. We're going to solve our own problems in the meantime. And we're going to work for those bigger changes. But our people need health care right now. They need it right now. And we can get it to them. And I think by New York City acting, the biggest city in the country acting, is actually going to create momentum for those bigger changes. Because people all over the state, all over the country are going to see, you know what? Universal health care really should be the goal. And we all need to get to work to make it happen. I would note one more point about Washington. In the last couple of years, there's been tremendous focus, tremendous energy, pinpoint precision in Washington among Republicans trying to reduce the amount of health care people get, trying to take away the right to health care, trying to water down Obamacare and debilitate it. Lots of time and energy has been put into taking away health care from tens of millions of people. What we're doing here in New York City, we're getting health care to a lot of people who never had it before. We're going the opposite direction. We're going to get it to everyone. So as this discussion has ensued, and I want to thank all of the people who have been a part of it. I mentioned several of them, but I also want to thank Dr. Auxilius Barbeau, our health commissioner, our commissioner for the mayor's office of immigrant affairs, Bita Mustafi, our OMB director will be with us here shortly, Melanie Hartzog, a lot of advocates who have fought for this type of idea and will be fighting in Albany and Washington, the New York State Nurses Association and Make the Road New York, and the New York Immigration Coalition, and of course Planned Parenthood have been fighting. I asked my team, what is it going to take? I said to them, here's the idea. Universal health care. Everyone gets served. Guaranteed health care for every New Yorker. What's that going to take? And it has to come with a clear ability of every New Yorker to get to an individual doctor that is their own, a primary care doctor that they will know by name and will be there for them. What's it going to take? And this plan, NYC Care, this plan we announced today, will achieve that goal, will achieve that vision. It has been years in the making, but we're finally ready to ensure that every single person gets served. I'll conclude by saying this. When you think about the people out there, the 600,000 people out there who have no coverage at this moment, they're all different kinds of New Yorkers. Some of them are young, and as Mina said, they think maybe they don't need insurance. Well, I'm here to tell them everyone needs coverage. Everyone needs a place to turn. Some folks just can't afford the policies that are on the exchange. Some people can't navigate the system. They find it overwhelming. Some folks are our neighbors who happen to be undocumented. What do they all have in common? They need coverage. They need health care. And we know this is the approach. We take the public option that is Metro Plus, we build it out, we strengthen it, we get it to more and more people, and we take the strength of our public health system, and we make it easier to use, and we make it user-friendly, and we make it accessible, and we give everyone that doctor by name, and we change the whole way people get health care. NYC Care is going to make a difference. For those who can afford something, they'll pay on a sliding scale. For those who can't afford anything, care will be for free. No one will be turned away, and care will be comprehensive. That is what we believe in New York City. Those are New York City values. No one gets turned away. Everyone is respected. So I've been talking over this last year or two about our goal of being the fairest big city in America. I can safely say guaranteeing health care for all New Yorkers is one of the big steps to becoming the fairest big city in America, and we're going to do it. We're going to do it, everyone. A few words in Spanish. No vamos a esperar más para hacer frente a esta crisis de atención médica. Hoy estamos garantizando cobertura de salud para todos los neoyorquinos. No importa si tengan documentos o dinero. La atención médica es un derecho humano. Medical care is a human right. Health care is a human right. Now, the idea of being comprehensive, would never work if it was just about physical health care. It only works if we include mental health care. 1 in 5 Americans, 1 in 5 New Yorkers deals with a mental health challenge every single day. And the reason in this city we are talking about mental health care in the same sentence with physical health care, the reason we have parity in everything we do, including the initiative that we announced today, is because our First Lady fought from day one to end the stigma, to make sure everyone got the care they needed. My pleasure to introduce Charlene McCray.
Thank you, Bill, and thank you, Mina, for sharing your powerful story. It means so much to the people that you serve that you're able to speak with them as a peer and to share that the importance of this coverage that everyone needs. You know, my parents used to say that if you have your health, you've got everything. You know, it all begins with being healthy. And I've added to that, well, if you have your health and your mental health, then you really can go on and do anything. For more than 3 years, Thrive NYC has worked to tear down the barriers to mental health care. We've taken on stigma. We've expanded access to mental health services in our schools and our neighborhoods. We have made it easier than ever to make an appointment with a counselor or a therapist through NYC Well. But for the 600,000 New Yorkers without any kind of insurance, mental health care remains out of reach. This year, we changed that for good. Guaranteed health care means guaranteed mental health care. There is no such thing as comprehensive care without mental health and substance use services. When New Yorkers enroll in NYC Care, they will be set up with a primary care doctor who can refer them to the many behavioral health services offered by the health and hospitals. They can receive services for alcohol and other substance misuse. They can get buprenorphine treatment for opioid addiction. Psychiatric and regular therapy sessions are also included. Of course, many people living with mental illness have no idea they have a mental health condition that can be treated. But their primary care doctors can help assess their symptoms and determine what is best for them, because they'll be supported along the way by Thrive NYC's Mental Health Service Corps. The Corps is made up of recently graduated master's and doctoral level clinicians who are placed in substance use programs, mental health clinics, and primary care practices throughout the 5 boroughs. Corps members often come from the communities that they serve. They speak many languages, represent the cultural and ethnic backgrounds of New York City. They serve where they can do the most good, in the highest need communities. Currently, nearly 50 Corps members proudly serve at 37 health and hospital sites across the city. From supporting the primary care doctors in assessing mental health needs to providing treatment like therapy, members of the Mental Health Service Corps will be essential in extending comprehensive coverage to every New Yorker. And they will continue to make mental health care in our city more accessible, inclusive, and culturally competent. With today's announcement, New York City is taking yet another leap ahead of the rest of the nation in mental health. No other city or state provides this level of care to all residents. And that is our goal, to make sure everyone has the care they need when and wherever they need it. Now, a few words in Spanish. La garantía en el cuidado de salud significa garantía en el cuidado de la salud mental. Con NYC Care, nuestra ciudad da otro paso adelante del resto del país. Ningún otro estado o ciudad ofrece todos estos servicios integrados de salud mental y adicciones a todos sus residentes. Thank you. Gracias.
Thank you. I want to emphasize in English the last point that Charlene made in Spanish. When this is fully implemented, it will be the most comprehensive health system in the nation. It literally means all 8.6 million people will have some form of coverage and will have access to health care, both physical and mental health care. There's no place in the country that has yet reached that goal. We will reach it here. And it makes us very proud as New Yorkers. Now, this wouldn't have been possible, as I said earlier, without extraordinary efforts to revitalize health and hospitals. And that was a very lofty goal some years ago. But Dr. Mina Palacio believed it could be done. She had great partners that she brought in to help achieve this goal. And we put the time and the energy and the resources into it, and it is all bearing fruit now. And I know she is proud of that, and she's especially proud to be back in her native Bronx. Our Deputy Mayor, Dr. Mina Palacio.